This spills and incident response training provides health and safety information to comply with federal requirements from organizations such as the Environmental Protection Agency, the National Institutes of Health, and the Occupational Safety and Health Administration. This training is for individuals who work with biological materials. The spill or release of hazardous materials may pose a risk to you, the community, and the environment. Biological spill kits must be available in all areas where biological materials are present for proper spill cleanup. Biological spill response kits typically include biohazard bags, biohazard spill sign, disposable lab coats or gowns, disposable shoe covers, hand sanitizing wipes, nitrile or protective gloves, mini brush and dustpan, paper towels or absorbent material, safety goggles or glasses, spray bottle to make a fresh bleach solution, tong or forceps to pick up broken glass. Bleach or other disinfectants are not included in the biological spill kit but must be readily available in the lab. There are different procedures for dealing with biological spills, such as inside a biosafety cabinet or spills in other areas. In the event of a biological spill less than 50 milliliters inside a biosafety cabinet, follow these steps. Step 1. In the event of a life-threatening emergency, call 911. Do not turn off the biosafety cabinet. Step 2. Secure samples. For example, place fallen containers upright or cover tissue culture dishes. Step 3. Wear gloves, safety glasses, a lab coat, and other personal protective equipment during cleanup. Step 4. Remove any pieces of broken glass with forceps or tongs and place them into a sharps container inside the biosafety cabinet. Step 5. Cover spilled material with paper towels to contain the spill. Step 6. Carefully pour appropriate disinfectant onto paper towels to inactivate the material. Proceed from the outer edge to the center. Leave for a contact time of 20 minutes. Step 7. Place the paper towels used to soak up the spill in a biohazard bag. Wipe down the surface with disinfectant, remove your gloves, and place them into the biohazard waste container inside the BSC. Step 8. Remove PPE, then wash your hands thoroughly. Step 9. Notify your supervisor. Your supervisor will notify environmental health and safety. In the event of a large biological spill that's more than 50 milliliters inside a biosafety cabinet or that generates splashes to multiple surfaces, follow these steps. Step 1. In the event of a life-threatening emergency, call 911. Do not turn off the biosafety cabinet. Notify everyone in the immediate area that there is a large spill inside the biosafety cabinet. Step 2. Secure samples. For example, place fallen containers upright or cover tissue culture dishes. Step 3. Remove gloves and dispose of them in the biohazardous waste container. Then carefully exit the BSC. Step 4. Put on a fresh pair of gloves outside of the BSC. Step 5. Ensure that the drain valve located under the BSC is closed. Step 6. Carefully bring paper towels and the appropriate disinfectant into the BSC to clean the spill. Step 7. If glass or other sharps are present, use forceps or tongs to remove sharps and place them in the biohazardous sharps container inside the BSC. Ensure that all materials used are placed inside the BSC and away from the spill. Step 8. Completely cover spilled material with paper towels to contain the spill. Step 9. Carefully pour appropriate disinfectant onto paper towels to inactivate the material. Be sure to completely cover the spill. Leave for a contact time of 20 minutes. All of the materials that were inside the BSC during the spill must be disinfected prior to being removed from the BSC. To disinfect the materials, follow these steps during the 20-minute wait time. Step 1. Identify an area within the BSC where the disinfected materials will be placed. Spray paper towels with disinfectant and thoroughly wipe the identified area. Place used paper towels in biohazard waste container. Step 2. Spray additional paper towels with disinfectant and carefully disinfect all materials that were present inside the BSC during the spill. Place used paper towels in biohazard waste container. Place the disinfected materials in the designated clean area. Step 3. Remove gloves and place them in the biohazard waste container. Step 4. Carefully exit the BSC. Step 5. Put on a fresh pair of gloves outside of the BSC. Step 6. Carefully remove decontaminated materials from the BSC. After the 20-minute contact period, take the following steps to resume the spill cleanup. Step 1. Collect the paper towels used to contain the spill by pushing them from the outer edge to the center of the spill. Add additional paper towels if needed to absorb the spill. Place used paper towels into the biohazardous waste container. Step 2. Spray fresh paper towels with disinfectant and thoroughly wipe down the spill area again. Step 3. Place used paper towels into the biohazardous waste container. Step 4. Disinfect the waste bag and biohazard waste container and remove from the BSC. Step 5. Place the biohazard waste bag into a larger waste bag for disposal. Next, determine if the spill reached the front or rear grills of the BSC. If necessary, flood the work surface as well as the drain pans and catch basins below the work surface with the appropriate disinfectant for a contact time of at least 20 minutes. After contact time, drain contents of the catch basin into a container. Next, lift the front exhaust grill and tray and wipe all surfaces. Be sure that no paper towels or solid debris are in the area beneath the grill. If using a disinfectant that is corrosive, remove residue with 70% ethanol to protect stainless surfaces. Dispose of cleanup materials in a biohazard waste container. Remove gloves and dispose in the biohazard waste container. Remove other PPE and thoroughly wash your hands after the cleanup. Report spills to your supervisor, and your supervisor must report the spill to EHS. Resume work if deemed safe by the supervisor. In the event of a biological spill outside a biosafety cabinet less than 500 milliliters, follow these steps. Step 1. In the event of a life-threatening emergency, call 911. Step 2. Remain calm. Inspect PPE for splashes. Step 3. Secure the samples. Alert other laboratory employees in the area and block off the area. Step 4. Always remove broken glass using forceps or tongs and place them in a sharps container. Step 5. Wearing gloves, safety glasses, and a lab coat, cover the spill with paper towels. Gently apply disinfectant, working from the outer edge of the spill towards the middle. Leave the disinfectant for a contact time of 20 minutes. Step 6. Pick up the paper towels and place in a biohazard waste container. Step 7. Clean the area of the spill again with disinfectant and place paper towels in the biohazard waste container with your gloves. Step 8. Remove other PPE and thoroughly wash your hands after the cleanup. Step 9. Report the spill to your supervisor. The supervisor must report the spill to EHS. Step 10. Resume work if deemed safe by the supervisor. In the event of a biological spill outside a biosafety cabinet more than 500 milliliters, follow these steps. Step 1. In the event of a life-threatening emergency, call 911. Step 2. Remain calm, notify everyone in the immediate area, and secure the samples. Step 3. Close off the spill area to prevent others from entering the area. All personnel must exit the room. All personnel must remove PPE and contaminated clothing before exiting the room, ensuring clothing does not come into contact with mucous membranes. Step 4. Restrict access for 30 minutes to allow for the dissipation of aerosols. Post a sign stating, "Do not enter, biohazard spill," with contact name and phone number. Step 5. All personnel must thoroughly wash hands. Personnel should wash eyes and exposed skin if needed. Step 6. Notify your supervisor. The supervisor must notify EHS immediately. Step 7. After 30 minutes, put on your PPE, including a lab coat, gloves, shoe covers, and eye protection. Use respiratory protection as needed. Step 8. Always remove broken glass using forceps or tongs and place them in a sharps container. Step 9. Cover the spill with paper towels and gently apply disinfectant, proceeding from the outer edge of the spill to the center for a contact time of 20 minutes. Step 10. Place contaminated clothing into a biohazard bag for autoclaving. Step 11. After 20 minutes, collect all the paper towels and other materials and place them into a biohazard bag. Step 12. Clean the area of the spill again with disinfectant and place paper towels in the biohazard waste. Step 13. Be aware that spills often generate splatter that may travel beyond the spill area. Thoroughly inspect the area and nearby equipment for any splashes that may have occurred as a result of the spill. Clean the splashes with a disinfectant for a contact time of 20 minutes and place all cleanup materials in the biohazard waste. Step 14. Remove gloves and place in the biohazard waste. Remove other PPE and thoroughly wash your hands after the cleanup. Step 15. Resume work if deemed safe by the supervisor. If the spill occurs inside equipment, such as a refrigerator or centrifuge, contact Environmental Health and Safety for guidance. In case of a life-threatening biological exposure, call 911. All exposures require immediate first aid and medical evaluation. For incidents occurring outside of regular business hours, contact campus police. In the event of an exposure to intact skin, take the following precautions. Remove contaminated clothing. Clothing should not pull over the face as contact with eyes, nose, and mouth may occur. If clothing underneath a lab coat is contaminated, and you cannot easily use a sink to wash a contaminated area, proceed immediately to the nearest safety shower. If you have an injury associated with the spill and skin is cut, punctured, or damaged, immediately encourage gentle bleeding at the puncture or wound site. Wash exposed area with soap and water. Seek immediate medical attention. Some medications must be administered quickly after exposure. Tests may also be necessary to determine further treatment. Campus Health Services is available to assist. Report the spill to your supervisor and EHS. Complete a university incident report form. Complete the workers' compensation claim forms within 48 hours. In the event of a biological exposure to eyes, take the following precautions. Immediately flush eyes for 15 minutes with water using an eye wash. Hold eyelids away from your eyeball and rotate your eyes so that all surfaces are washed thoroughly. Remove contaminated clothing. Clothing should not be pulled over the face as contact with eyes, nose, and mouth may occur. Seek immediate medical attention. Campus Health Services is available to assist. Bring any information about the biological materials involved to the healthcare provider to help guide treatment. Report the exposure to your supervisor and EHS. Complete a university incident report form. Complete the workers' compensation claim forms within 48 hours. In the event of ingestion or inhalation of a biohazard, take the following precautions. Move to fresh air immediately. Call 911 immediately if the individual is unconscious or unresponsive. Seek immediate medical attention. Campus Health Services is available to assist. Bring any information about the biological materials involved to the healthcare provider to help guide treatment. Do not induce vomiting unless advised to do so by a healthcare provider. Report the exposure to your supervisor and EHS. Complete a university incident report form. Complete the workers' compensation claim forms within 48 hours. Immediately report all incidents with synthetic or recombinant nucleic acid molecules to your supervisor and EHS. Exposure or incidents with synthetic or recombinant nucleic acid molecules must be reported to the National Institutes of Health by the institution. Incidents with synthetic or recombinant nucleic acid molecules will require follow-up, including medical consultations and recommendations to prevent future incidents. To receive credit for this training, complete the test with a score of at least 80%. For questions or assistance, contact EHS.